Think about this for a second. What if you could fix a problem deep inside the human brain without ever making a large incision? I know, it sounds like something straight out of science fiction, but it's literally happening every single day. So today, we're going to dive into the incredible world of neurointerventions.
So, why is this field such a huge deal? Well, picture this. Someone you love is having a massive stroke. A blood clot is blocking a major artery in their brain, and it's starving it of oxygen. With every single second that ticks by, millions, literally millions of brain cells are dying. I mean, it is a terrifying, terrifying race against time.
That sounds impossible, right? To somehow reach into the most delicate, complex organ in the entire body and just pull out a tiny, life-threatening blockage. But what if it wasn't impossible? What if you could?
And that is the harsh reality of what's called an acute ischemic stroke. When a major blood vessel gets blocked, the clock is ticking, and it is ticking fast. You know, there's this saying in medicine, time is brain, and they mean that literally. The faster you can get blood flowing again, the better the chance that person has of a meaningful recovery.
And this is the incredible solution. It's a procedure called a mechanical thrombectomy. It's just, check this out. A specialist guides this tiny, super flexible tube, it's called a catheter, from an artery, maybe in the wrist or the groin, and navigates it all the way up into the blocked vessel in the brain. Once they're there, they push out this tiny device. It kind of looks like a miniature cage, and it grabs onto the clot. Then they carefully pull the whole thing all the way back out. And just like that, blood flow is restored. It is nothing short of a medical miracle.
Now, that amazing stroke treatment, that's actually just one piece of a much, much bigger puzzle. It belongs to a specialty that you can really think of in a super simple way. It's basically high-tech plumbing for the brain. Okay, so the formal name for this field is neurointervention. It's a field where doctors use really advanced imaging. We're talking live X-rays to pilot these tiny little instruments through the body's network of blood vessels. And their destination? The brain and the spine, where they can fix all sorts of problems without ever performing major open surgery. And yeah, that plumbing analogy, it is just perfect. You've got this specialist who is essentially a master plumber for the most critical pipes in your entire body, navigating this incredibly intricate network of arteries and veins to fix blockages, repair leaks, and get everything flowing just the way it should.
Now, this amazing ability to, perform plumbing inside the brain, it didn't just pop up overnight. Nope, this is a story built on decades of absolutely brilliant innovation. And this timeline, wow, it really shows you just how fast this field has evolved. It all started back in the 60s and 70s with the very first attempts to even see inside blood vessels using dyes and using really simple balloons. Then boom, the 90s hit, and we get a massive breakthrough, these tiny detachable coils that could be packed into dangerous brain aneurysms. Then in the 2000s, those stroke treatments we just talked about were proven to be incredibly effective. And now, today, the field is just exploding with things like flow diverters, liquid glues, and even robotics helping out. It's incredible.
So, okay, with all that history and all that innovation, what can these specialists actually do today? What's in the modern neurointerventional toolkit? Well, the range of problems they can solve is truly impressive. This table gives you a really good sense of the sheer range here. We've already seen thrombectomy for strokes and coiling for aneurysms, but check out what else is on this list. They can treat something called an AVM, which is this dangerous tangle of blood vessels, by blocking them off. That's called embolization. They can use stents to prop open narrowed arteries to prevent strokes from even happening. They can even help surgeons by using that same embolization technique to cut off the blood supply to a tumor, which makes it way easier and safer to remove. The versatility is just mind-blowing.
Okay, let's zoom in on one of these, just so we can really appreciate how clever these solutions are. We'll look at aneurysms. Those are those dangerous balloon-like bulges on a blood vessel wall that have a risk of bursting and causing a really devastating brain bleed. And here's what's so fascinating. There isn't just one way to fix this. On one hand, you've got coiling. Doctors can navigate a catheter right inside that fragile bubble and pack it full of these incredibly soft platinum coils, which basically seals it off from the inside. But for other types of aneurysms, they might use a totally different technique called flow diversion. Here, they place this fine, mesh-like stent in the main artery, right across the opening of the aneurysm. This redirects the blood to flow right past the weak spot, which lets it slowly shrink and heal on its own over time. So you see, two totally different approaches for the same basic problem. Absolutely brilliant.
Okay, so you're probably wondering who are the people pulling off these incredibly delicate procedures? Well, let me tell you, this is not a one-person show. It takes a whole team of highly specialized experts working in perfect sync. First up, at the heart of the procedure, you have the interventional radiologists. These are your pilots, right? They are absolute masters of medical imaging, and they have the incredible dexterity to navigate those catheters through all the winding pathways of the body to get to the exact spot in the brain. Then, working right alongside them, you have the neurosurgeons. They bring this just unparalleled understanding of the brain's anatomy, and what's really cool is they're experts in both traditional open surgery and these modern techniques, so they can even combine the two if a case is particularly tricky. And you can't forget the neurologists. They're absolutely essential to the team. They are the experts on the patient's underlying condition. They're crucial for figuring out who's a good candidate for a procedure, and then they manage the patient's care before, during, and long after the intervention is over. And really, it all comes down to this one essential truth about this field. None of this is possible without seamless teamwork. The radiologist, the surgeon, and the neurologist, they all have to combine their unique skills to get the best possible outcome for every single patient. So, when you put it all together, the amazing tech, the decades of innovation, that critical teamwork, what do you end up with? Well, you get a genuine revolution in how we care for the brain, a minimally invasive revolution. And this, right here, is the bottom line. This is why it all matters so much. For the patient, the advantages are just huge. We're talking smaller incisions, which means fewer complications and less stress on the body. These procedures are often literally life-saving in an emergency. And because they're less invasive, recovery is faster, hospital stays are shorter, and people can get back to their normal lives so much sooner. So, here's the ultimate takeaway from all of this. Neurointervention isn't just some small improvement. It's fundamentally rewriting the entire playbook for how we treat some of the most complex and dangerous diseases of the human brain. Which, of course, leaves us with one last fascinating question. We've gone from simple balloons to sophisticated robotics in just a few decades. So as this technology just keeps getting smaller and smarter and more precise, what will be the next frontier they allow us to explore and to heal deep inside the human brain?